Thank you for pressing play on the Inside Deschutes County podcast. Wherever you might be and however you might be listening, we appreciate you making us a small part of your day. Be sure to catch us wherever you listen to your podcasts. You can also find us on Deschutes.org/podcast.
Deschutes County is an amazing place to live,
Ease of access,
work, and play.
Great place to raise a family.
I love the weather and the high density.
At Deschutes County, we provide excellent service.
Beautiful.
We're here to help you.
Deschutes County is the heart of Oregon.
Everyone wants to be here.
This is episode 20, a bonus episode, if you will, of the Inside Deschutes County podcast. Thank you so much for listening. I'm Eric Brion. We're going to jump right in. School Exclusion Day is February 21st, right around the corner. And we wanted to bring two guests on to talk about what this all means. Deschutes County Health Officer Dr. Fawcett, a friend of the show, a repeat guest, is here, and Sarah Van Meter, Immunization Coordinator for Deschutes County Public Health. Welcome to you both. Thank you so much for being here.
Thank you.
I'm going to start with Sarah. You're on the spot here. Can you just give us kind of a basic description of what School Exclusion Day is?
Sure. So Oregon state law has required all children in public and private schools to be up to date on their documentation and on certain vaccines.
Dr. Fawcett, which immunizations are we talking about here?
Right. Well, some of these are very familiar. Typically the MMR and the DPT, so that's measles, mumps, rubella. And the DPT is diphtheria, pertussis, and tetanus. And then there's some other ones that are very useful, hepatitis B and hepatitis A, chickenpox vaccine, and then I think a vaccine against Haemophilus influenza strain B, which is a pretty dangerous bacteria. So those are the ones that I think are usually required.
That's a lot.
Yeah, it is.
So did we get them all?
Polio.
Oh, polio.
polio.
I'm sorry, polio. Yeah,
Don't forget polio.
Yeah, polio. That's one of the first ones, actually. Yeah.
Otherwise, yeah, spot on.
It seems simple, but why are these so important to get up to date on? I mean, obviously we don't want them. We don't want to get those things. But talk about just how the School Exclusion Day came into being and why it's just so important that they decided to put these things into effect, either one of you.
Well, some of these diseases nobody wants to have. I think polio is a great example that can cause paralysis and death, and often strikes unpredictably in a lot of communities, suburbs, etc. And then some are just very, very contagious. Measles, for example, can cause lots of different conditions, even death. But more importantly, it's just very, very contagious. Can keep a lot of kids out of school for quite a period of time. And I think the other thing to remember is that a lot of folks, because of their other medical conditions, either can't have all the vaccines, or if they do get these infections, they get sicker, end up in the hospital. Sometimes they can't be treated. So we try to protect those around us in the schools and other places who are most vulnerable by these vaccines as well.
Sarah, do the requirements vary by age or grade in terms of what kids need what and when?
Yes. Really, they break it down into preschool, and then K through 5, and then 6 through 12. And the requirements vary on the age and the grade level.
Are there places where people can see that information as to like what they need?
Absolutely. OHA, Oregon Health Authority, has a wonderful website that breaks it down for parents and for the child care facilities and the schools as well.
You mentioned it off the top, but this is required by law.
Correct.
And how long has this been going on, do you know? A while.
Yeah, for a really long time. As far as what vaccines have been necessary, I mean, it's varied, by time. They didn't all start out being Hep A and, Hib and all of that. So that's been the variant, but it's been in effect for years.
What schools are included in this? Is it obviously public schools, but I'm guessing, does this apply to private and preschool and maybe even daycares? I don't know. I mean, maybe you can explain a little bit.
Yeah, absolutely. Certified child care facilities, preschools included, public, private, Head Start programs. Yeah.
All of them.
All of them. Anywhere that any child congregates more than 5 times a year.
So I know, going to ask you, Sarah, another question. Sorry, Dr. Fawcett.
No problem.
I know you've been busy. So you told me that when we talked about doing this, you're like, well, I'm busy. I'm doing stuff. What exactly are you doing to get the word out about this?
Well,
Or what? Anything else that you might be doing?
oh yeah, it starts way like in the summertime. We try to reach out as much as possible to the schools. I mean, we have a wonderful school system here that they're on it, you know, but we have to send some gentle reminders out to child care facilities, especially new ones. And so we start doing that in the summer, at the start of the school year, per se, like in the fall. That's when the facilities are collecting all the information, all the certified immunization status, the records from each of the children so that they can remain up to date. So really, if they start early and are organized, it makes everything easier for everybody when the reports are due. So this year, January 17th, was when the primary report was due. So that includes total enrolled, what kids are up to date, what kids are not. So this season, I had quite a few incomplete status children that they have to receive an exclusion letter or just no record because maybe the folks moved from out of state and didn't supply the record. So it's a lot of kind of legwork to get everybody kind of registered into the alert system.
Yeah, I was going to ask about how many people, how many students, maybe we know or don't know the answer, but how big of an issue is it? You know, I mean, in terms of, are there a lot of kids that don't get these up to date, or are we just talking a few that maybe, I mean, because we said this has been in effect for a while, so I'm assuming most people are up to speed on this, but is it still a big problem?
Yes, I would say. I mean, more and more, wouldn't you say, Dr. Fawcett?
I think so. I think it's unpredictable. I think you make a good point that sometimes it's an issue in just getting the records verified or, getting the documentation in on time. And sometimes it's a easy fix. Other times it's more complicated.
Dr. Fawcett, are you seeing problems in schools when it comes to these diseases? Have you seen outbreaks of, obviously not polio or things like that, but I mean, are you seeing other things like that? You know, I mean, chickenpox probably still a thing. So, but
Yeah,
I mean, are there cases? I mean, I don't know. Is it a problem in these schools?
I mean, we've had a case of polio in this country not very long ago on the East Coast, and so we worry that this could resurge potentially. But I think more than anything else, when we have a sporadic case of something that's very contagious like measles, we do kind of worry about the school environment. And if we have a lot of folks that are unvaccinated in a school, in a classroom, in the case of measles, I mean, there's a very high chance that this will spread very quickly. And then sometimes we have adults, too, in the school setting, who are immune compromised or somewhat medically fragile and where they could really be ill, hospitalized even if they themselves contracted measles. So we just think some of these diseases can spread very quickly under the right circumstances, and vaccines one of the things that's pretty effective in blocking some of that transmission.
And Sarah, you were saying in Washington, they're dealing with something like this, right?
Right. They had some confirmed cases of measles amongst unvaccinated adults. And so we've been keeping a close eye on that and making kind of our game plan, what we would do to reach out to schools and child care facilities. Because in the end, if it is that there are kids in school that have not received their vaccines, then it is within the realm of not allowing them to come to school, just in order to protect them
Without getting into the controversy of immunizations and the debate about it, I think people might want to know, have any been added as a result of the pandemic or anything like that? So there's nothing COVID, there's nothing even RSV on this?
No.
No, not
Okay.
at all.
Okay. Are there any exemptions? So like if somebody has, a religious reason, can they apply?
Yeah. So that, like any kind of philosophical, religious, or, just personal reason, parents are able to, or children 15 years and older can get a non-medical exemption, and that's done by going to their physician and talking about becoming educated about the different vaccines and perhaps the person's reason for not receiving it. Or there's an online module that they can watch and then sign and turn into the schools. There's also 2 different types of medical exemptions. So there'd be the permanent medical exemption. That would be something health-wise that would be an unresolved, never will they be able to receive it. We also have temporary medical exemptions, and those would be if they had something that happened in their past, let's say a transplant, or something that they're on a delayed, vaccine schedule. So it's expected that they would receive all of them, but for now, they're just taking the physician, under the physician's orders, they're taking their time to receive their vaccines.
What about resources? If they want to get information about these, either the diseases or the immunizations themselves, any places where they can go to find information to learn?
Well, first and foremost, I would say start with your physician.
Your pediatrician. doctor.
Absolutely, yeah.
And I think they're a good guide, too, for other resources, maybe online. There's just a lot of information, obviously, that's available to everybody through the internet, but it's nice to have a bit of somebody who can help navigate that so you know what are the most reliable resources. And if you want to go beyond that, that's great, but to know from somebody who has experience like your primary care provider where to start is great.
Mm-hmm.
And that's probably the place to go, right? It seems like a simple question, maybe a silly question, but where should they go to get these immunizations if they don't have a primary care or a pediatrician? Are there options?
Oh, absolutely. We try to persuade people, if they don't have a physician, to go to the student-based health centers that we have in the area. And just so I don't forget, we have one here at Bend High, and there's one at M.A. Lynch Elementary in Redmond, and Sisters High School has one, and so does the Lapine Student-Based Health Care Center. And they do take walk-ins, we tell people, but we also recommend that they make an appointment so they don't have a long wait. But it's available for children's, 0 through 18, so it's a really nice resource. Of course, there's the county. So I've already started immunizing children to get up to date. That started back in December, but they can call and make an appointment. And also, local pharmacies for children 7 years and older.
So there are options.
Absolutely. Mm-hmm.
Lots of places to go.
Yeah, especially this last minute sort of thing, when parents are scrambling and can't get an appointment with their primary, there's other options for them. So.
Are you hearing any common questions? Is it the where to go? Is it, from parents? Is it the deadline? What are you hearing most from them in terms of, the biggest question?
Strangely, I communicate more, I feel like, with the child care facilities and the schools. And I'm answering their questions on behalf of the parents. It seems that the parents do a really good job of contacting the schools first. And then after that, it's as though the parents come to me to receive the immunizations, and that's when they ask specific questions about vaccine. And of course, before I ever give a shot, I give them a vaccine information statement, and we talk about it. And there's already been some parents that were quite behind on their immunizations for their children. And so we talk about, what's a reasonable way to get them caught up so that they don't have to have 6 shots in one day.
February 21st. Mm-hmm. They need it before that day, or
They can even receive it on that day and then show up at the school with their, updated immunization record for the children, and the children would be allowed to go to school that day.
February 21st. We just
Yes.
want to say that that's
thank
coming
you
up
for-
quick. So, yeah. So as of this recording, it's February 9th. So
Right.
we're coming pretty quick. So,
Yeah.
anything I missed? Is there anything that in regards to the immunizations themselves, or the questions about the program, or anything resource-wise? I'm assuming this is laid out on Deschutes.org somewhere for everybody to read.
And we do have a vaccine hotline people can call, and it's a pre-recorded, and it also with the opportunity to leave a message if they want to ask a question and can't get a hold of me readily by my direct phone number. And so I can return phone calls that way. But yeah, I always recommend people go to the OHA website because I feel like it's very intuitive. It's laid out, and it's just a really great way to get your basics if you're unable to talk to your primary.
Well, Dr. Richard Fawcett, thank you. Sarah Van Meter, thank you for popping on to talk about School Exclusion Day. We really appreciate it.
Oh,
Thanks, Sarah. Thanks for having me.
Yeah.
If you would like to go to a school-based health center for immunizations, those living in Jefferson and Crook counties and the cities of Bend, Redmond, and Sisters can schedule appointments by calling 541-383-3005. If you're in La Pine, you should call 541-536-0400 to make an appointment at the La Pine School-based Health Center. For information on Oregon's immunization requirements for each grade, you can visit Oregon Health Authority's Required Shots for School and Children's Facilities webpage. And if you have questions regarding immunization requirements for school at all, please call the Deschutes County School Law Information Line at 541-322-7451. That's 322-7451. Thank you again to my guests, Dr. Richard Fawcett and Sarah Van Meter. Until next time.